Loud. Fantastic. Hello and welcome. Got any spoons? I'm your host, Ann, and I have Amberlyn with me again. Yay!
Hello.
As she will be for ever and ever more. I've trapped
Forever,
her.
as long as you'll have me.
And so, we are both zebras. We both have Ehlers-Danlos syndrome, Ehlers-Danlos syndrome, Ehlers-Danlos.
It's however
Whichever
you want to say it.
however you want to say it. We have
Hmm.
EDS, and that makes us a zebra. There were some questions about that. Zebra, because in the medical world, when you hear hoof prints, you think a horse, not a duck. If it
Right,
looks like a duck and it quacks like a duck, apparently it's a duck. But if you hear hoofs, it's a horse. But no,
right.
no, no, no. We're unique. We're zebras, or actually, me, myself, and I'm a mandarin wood duck. It's all rainbow colors. And the ducks, they paddle, 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 paddle
Yeah.
underneath, and they look all calm on the
Uh-huh.
surface. Yes, that's me. I'm a
That's
mandarin
you.
wood duck. I just
I
look at
love
my
it.
little ducky hair flips. I've but I'm wearing black so that I could fit in
It's
with
to throw them off. It's you never want to keep, they never want to anticipate what you are, you know?
no.
You can feel
Yeah.
the shadows.
We're gonna keep them guessing. Um,
Yeah.
and today, being the beginning of the year, we did try to do this once, and I lacked the tech savvy skills to get this going. So we're gonna go over EDS 101 again. Amberlyn is very educated. I, on the other hand, maybe
You
very
are.
different. We are the tale of two zebras. So, um,
Very true.
very true. Because I was diagnosed at 48. And so I have a lot of history without the
Yeah.
actual knowledge that would have been beneficial. Um, so if people are thinking that they have EDS, what are some, or maybe they don't and they're sick, what are some of the classic EDS stuff that we could talk about to say, maybe you should talk to your doctor?
Absolutely. Yeah, I think the biggest thing to remember between EDS, or hypomobile EDS especially, and hypermobility spectrum disorder, the only difference is the Beighton scale. So it's what you are able to do and what applies to you. Now, if you have hypermobility spectrum disorder, basically means you are very bendy, but you don't have all of the comorbidities that come along with EDS, and you don't have all of the additional health issues that come with EDS. Now the biggest thing for EDS, I personally figured out that I had EDS 2 years ago on TikTok.
Cool.
And I saw someone doing the bite and scoring, and I was like, I've been able to do that my entire life. And I looked into it a little bit more and realized that I'd had some of these symptoms my entire life, like the migraines, growing pains, gastrointestinal issues, allergies.
Mhm.
And so I went into my primary care and was like, I need you to convince me that I don't have this. And he was like, I can't.
Right.
So the biggest thing that I took with me was the Beighton scoring. And if you go to the EDS Society website, they
Mhm.
have the actual scoring chart on there that you can
Mhm.
print out and take in with you. Or if you're on TikTok and you follow me, it's in the link in my bio as well. Easier
Yeah.
way to find. Um, but we can go ahead and do the Beighton scoring right now, just so you know what it looks like. I
Mhm.
top out at 9 out of 9. I ace it. I practiced. No, not really, but it's one
Oh,
of those things where I did all these things, was like, oh crap, I guess there is something wrong.
yeah.
Um,
And it's probably
mhm.
important to note real quick that with EDS, there are 13 different subtypes. The
Yes.
hypermobile is what we both have, and it's the only one that doesn't have the genetic decoded. You can't get a genetic testing to confirm it, but
Right.
it does have the bite and scoring, which is very useful, and they're working on doing the coding. So
Yes.
there's a whole lot more to this, but this is what we share, and this is the most common type. and this is what we can, share to help others. So with Amberlyn, she brought the bite and scoring to her an appointment, and you get points for what flexibility you have. So I'll let you
Mhm.
take over, Miss
Yeah,
Amberlyn.
absolutely. So the highest you can get is a 9 out of 9, and this is all based off of physical symptoms. Once you get down to criterion 2, criterion 3, it goes into the additional factors like, does anyone in your family have it? Did you have this from this certain age to this certain age, especially dealing with pain through adolescence? It's a big thing that they like to focus on because I didn't know this until about a month ago, but you're not supposed to experience growing pains. That
It
that's not
blows my
that's not
mind.
normal. Right!
I
The normal amount of pain is none pain.
none pain.
None. I've never experienced that.
Mhm.
That was a big one. People that don't have chronic illnesses go through life day to day able to get up, go to work, do the next thing, and it comes to them with ease. Is it frustrating? Do they have their struggles? Absolutely. But they don't hit the wall of I can't roll over to get out of bed because all of my ribs subluxed while I was asleep and it feels like they're puncturing my lungs.
Yep.
Or I slept wrong on my hips, so now my hips feel like they're grinding together in my pelvis. People don't experience that. And if that's something that you're experiencing, it's not normal, and that's the whole reason why we're putting this out there is to show you that you, for one, you're not alone. For two, you're not
Mhm.
crazy. Even if your labs and your scans and everything are coming back normal, that's what this disease does to you. Gaslight the disease gaslights you.
Oh,
But
yeah, definitely. Yeah. If you
this
have
is what the
super velvety, soft skin,
yes.
you might have EDS. If you have a high, narrow palate, you might have EDS. Some
If
people
your
have the
skin
stretchy.
if it stretches
Yes.
past a quarter of an inch past the normal level of your skin, that's part of EDS testing. Now, it's not part of the Biten scale, and we'll do that real quick.
Hmm.
The first thing we're gonna do is they have you put your hand flat on the table and then see if your pinky can go up 90 degrees without anything else touching it. And mine does
Right.
that on
And
both
you get
sides.
one per pinky. You have to do
Yes.
both sides. Okay.
Yes. The second one is your thumb. If you can get it to touch your forearm, there we go. Y'all
Mhm.
can see. And then the other
There's
one,
3 and there's 4.
4.
She's got 4 on the biting scale so far. 4 out of 4.
Your elbow, normally it's supposed to stay about right there. Mine bends out. Same thing
5,
with this one.
6.
Yes. Then I'm gonna go ahead and turn you to the side because the next one is back. Okay. So if you stand flat on the ground and touch the ground, hands and feet flat on the ground.
7.
Your knees are normally supposed to stand like this, but mine lock
I'm sorry.
back.
8
it's,
and 9.
it's
There
my
we
flamingo legs.
go. And
Thank you.
from an older zebra, I have lost some of my flexibility, but I was diagnosed by a geneticist that I found who specializes, who does telehealth, and you can pay out of pocket.
Mhm.
Um, and so he did a video like this, and I went through all of that, and there there was one I couldn't do. I think it was the touching of the floor.
Yeah.
Um, at the time, he's like, "Have you ever been able to do that?" Yes, that was a normal part of
Yes.
my life. So if you have someone who is familiar, and if you're a little bit older, um, it's it even says on the piece of paper,
It does.
if you could do this when you were younger, because things
Right.
do get stiffer and harder, and the disease is progressive. I can say that.
Absolutely.
To my
Yes.
knowledge, the disease is progressive. I am not a doctor.
It absolutely is, and here's the thing, on TikTok, Dr. Gumby has actually gone over this, is the fact that with this disease, there are 3 stages. You have your adolescence, where you're very bendy, very
Mhm.
muscular. Most of us are neurodivergent. So, with that, you're constantly going and involved in things because you need that input.
Mhm.
That goes straight into the pain phase. That's the phase that I'm in now, where I'm still very bendy, but when
Mhm.
I bend, it hurts.
Mhm.
After that, you hit the arthritic phase where everything locks up, everything gets stiff, and everything is harder to move. And that's unfortunately where a lot of our zebras come into the aspect of having to get joint replacements and things like that. But with EDS, a lot of them fail, and you end up having to get it redone over and over and over, anywhere from our bodies rejecting it all the way to you still having connective tissue issues that will never go away and then not being able to hold that implant in place where it's supposed to be. So it's a constant, it is very progressive. It's a constant battle. And it's frustrating when you don't understand what's going on with you.
Yeah, definitely. And as a woman, there are other considerations. I would never tell anybody to have a child or not to have a child. Some
Absolutely.
people want that information. Um, Regardless, if you know you have EDS and you are pregnant, that is a big deal that the doctor
Yeah.
needs to know. There are best practices like stitching, things
Yeah.
closer together because our skin is lax. Um, Personally, I've had the hysterectomy, but then I've also had
Yeah.
full prolapse repairs and nobody knew. Um, but it makes sense now
Yeah.
of why those prolapses continue. But that's
Mhm.
another challenge of our skin and our connective tissue
Yeah.
stuff.
I will say I've been pregnant 5 times in total. I've got 3 living children, 2 of them were miscarriages, but the 3 that were living all had complications during pregnancy. Prior to my pregnancies, I experienced some back pain here and there, but I had been in a car accident, I had an accident in basic training, and I've had migraines since I was 4. Other than that, well, I did get shin splints a lot. Other than that, I didn't experience EDS. So I never looked into what it was because I had onesie twosie symptoms. But
Mhm,
after I had kids and after I had my hysterectomy, all of my symptoms started to set in. And so I started realizing I think something is wrong
mhm,
because I was never having these symptoms before, and I've heard that be this case so many times,
mhm,
that once someone either goes through puberty or once they have hit the childbearing age and have decided to have kids, that's when they get sick, and I'm along the same lines as you, is where I will never tell anyone not to or to have children, but it
mhm,
is a very serious illness that needs to be monitored, and you need to be in touch with a prenatal geneticist. Almost all OBs can either have one or they can refer you to one to where they can help you with the questions that you would have in regards to having a child with EDS. Now, I've got 3 very healthy school age children that all have EDS. They're
mhm,
thriving. They're good. It does not take away from their quality of life. But there are so many more medical appointments. There's more things we have to monitor. They deal with migraines. Like there's
mhm.
a lot that goes into it that falls on you as a parent.
Yeah, definitely. And and I mean, because you would have gone through the pregnancies and you've known now for 2 years that you have EDS?
Yeah.
And they're all school age, so you went
Mhm.
through their infancy without knowing, that
Right.
any of you were in that situation. Um, I think the frustrating thing, and I don't know if you felt this in my situation, things kept happening that they told me couldn't happen, and then I wouldn't get treatment because
Yep.
they wouldn't they didn't believe me, and
Mhm.
and so, uh, yeah. So
No, it's so true. And
yeah.
they would the common term was, "Oh, that can't happen. That is so rare. That would never happen." I was bedridden from week 9 with my daughter because I had too much fluid in in my uterus.
Mhm,
And they were worried her heart wasn't gonna form. All this, they're like, "This is so rare. I we've never seen this before." It's not rare with an EDS pregnancy. It is so common to have either heart defects, birth defects, or amniotic issues.
Hmm.
So if I were to have known, it would have changed my treatment drastically.
Right. Yeah. I have two children. I've only had two pregnancies. I don't believe the first one has EDS. And
Yeah.
that pregnancy was beautiful. It was the delivery that almost did me in. The second
Yeah.
one, I had a terrible pregnancy with so many complications, and that one
Mhm.
does have EDS. And so
Yeah.
I don't know how that goes, but I always wanted to tell I was a MOPS mentor, mother of preschoolers.
Mhm.
And so for the first one, yes, I tore all the way, had all the stitches, had to have a little bit of reconstructive work. And they told me to just relax. And when I did that, the stitches all ripped out. And
Yeah.
I called them and they said, that can't happen. And then I passed out.
Oh my
So it was
goodness.
my husband coming home and finding me and bringing me in, and because it was too late, it had been more than 6 hours, they couldn't surgically correct it, and instead I
Oh
had to
my
go to the
goodness.
doctor every day and be cauterized, and that isn't something that needed to happen, uh,
No.
but Oh, one, I guess I am of that generation that very much felt that doctors knew everything. And this I
Mhm.
was 23 and this was my first pregnancy. And the whole pregnancy, the doctor was telling me that I'm like, I'm concerned that I'm going to have a big baby. You're not going to have a big baby. I had a big baby. I'm
Yeah.
worried about this or I'm worried about that. And I got food poisoning during Thanksgiving and my child was due in January. And so we called because I'm losing all of my electrolytes and, being
Yeah.
sick. And he said, stop drinking water.
So you wanted to hydrate you too?
Well, I was already dehydrated.
Like,
I was like,
I
nothing's staying in me. I'm so sick. He's like, stop drinking water. Then you'll stop puking.
what?
I know. I know. I
I
know.
wanna know where they're getting their degrees, and I swear back then, they must have had them, like, the little prizes you can get in the Cracker Jack boxes? They found the golden ticket somewhere in there. It was like, "Congratulations, this is your doctorates."
There, there is a TikTok uh, that she has. She plays like 4 or 5 different roles. So she goes and she's like, "Okay, now all of you are testing for your final to receive your doctorate, and this is your final questionnaire. You have a female patient who presents with A, B, C, D, E, F, G, and they're legit, problems.
Yeah.
What is the diagnosis?" And somebody says, "Oh, EDS with blah blah blah," and they're like, "Anxiety? Correct." And she goes to the next one. "You have a patient that comes into the ER with heart palpitations. Do you check for a heart attack? Do you check for a stroke? Or do you send them on their way with some breathing exercises because they have anxiety?"
Anxiety every single time.
And I was just like, "Oh, this is like
It's
traumatic
tr
'cause this is
my
so."
trigger. Literally, my cardiologist, initially, I had to teach him what POTS was, because he was like, "You have," because I, unfortunately, in my records, have generalized anxiety disorder. But
Yes.
not just that, I also have post-traumatic stress disorder in my
So do
records.
I,
So
yes.
as soon as they see that, they're like, "Are you anxious? Are you nervous? Are you is that why your heart's racing? Is it because you're stressed out?" I'm like, "N no, I don't faint for my pleasure." And, I don't think I've ever fainted from stress ever.
Well, well,
Um, I do get very fidgety, but I've never felt my heart race from that. He was like, "Well, your EKG looks fine." I love that for me, thank you. "Have you heard of POTS?" And he was like, "No." He had been a cardiologist for 27 years. His main his main patient net of people were the older community.
Mm-hmm.
So older people who are going through starting to experience heart issues need to be on those meds. All right, cool. So me
Mm-hmm.
walking in there at the time I was 30, he
Mm-hmm.
was like, "Why are you even here? And why are you using a walker?" Okay, well, let's go ahead and explain this. And as soon as I said I had Ehlers-Danlos syndrome, he goes, "Can you do the weird skin shit?" Yeah, I can, but that's not why I'm here. And if you all ever have a doctor that you're not even seeing for an EDS related issue and they ask you to do a party trick, say no. You
Yes.
you are not a traveling circus show. You are not a one-trick pony, and it injures you every time that you do it. Your joints can go that far, but they're not supposed to. So
Right.
every time, think about it like little micro tears happening every time you put that joint where it's not supposed to go.
Yep.
And every time that you show these people that are literally doing it for an entertainment basis only,
Mm-hmm.
it's at their own game. It does nothing for you.
I went and saw an orthopedic doctor because my kneecap was just, sliding in it. Like every time I
Mhm.
sat down, it would like pop out, and I'd be like, and then you stand up and
Yep.
you've got to like, um, the movie where what's his name like slams his elbow or his shoulder back into place.
Literally, that's what I do with my
Yeah.
knees.
Yes. And I was like, here we go. Bam. And my husband was like, honey, I don't think you're supposed to have to do that. Could you please go to the doctor? And I was like, yeah, okay, you're right. It just keeps doing it. And it's really painful to slam it back
Yeah,
into place. I don't know if you do. You watch football. You're a big football
I
fan.
love football.
And a couple years ago, my quarterback, Mahomes, he was
Mhm.
like, I looked at my leg and my kneecap was over here. I don't think your kneecap's supposed to be over there. I'm like, right? You can see
Right?
that. And then
You're
people are
speaking
like,
my
oh
language.
my God. It's like, I'm sorry. So when I went to the orthopedic and I was like, he's like, so what's the problem? I'm like, well, it does this. He's like, really? I said, yes. And I have EDS. And he's like, really? I said, yes. But we are at an orthopedic. We are talking about my kneecap.
Right.
So he wanted to measure the degree of which I can hyperextend my knee. I
Mm,
said, I don't really like to do this. It does.
yeah,
He's like, I do need it since I'm the orthopedic doctor in your treatment. I need to know the level, the extent of your flexation. And I'm like,
mhm,
all right. And he was like,
I guess so. Their face every time. My favorite's the
he's like,
gasp when I
do you,
touch the ground. They're like,
yeah. Do you have your protractor out, by the way? I mean, it's gonna
right? Which direction do you want me to go?
do you gotta set up right? Because here we go. Japan.
You get one time. You better be ready.
And guys, our illness is serious, but we do deal with doctors all the time. And I don't want to think that doctors are uneducated. There's just so many specialties. We have so many silos. We have so many things. And even within orthopedics, you can be like, oh, I don't do feet.
Yeah.
Okay, that's a podiatrist. How do you do feet or hands? And then, but you need somebody who knows EDS because,
Yes.
like, I have a port and I've been TPN dependent for 7 years because what? Why? Well, guess what's inside me? Connective tissues that don't
Yeah.
work. Sometimes I find it hard to swallow. Sometimes my voice changes because I can't make it work like it's supposed to. Um,
Yeah.
that's and having a J tube without knowing I had EDS, the stoma just kept
Oh
growing.
my
I'm like,
gosh.
this isn't supposed to happen. And I
Yeah.
can just about guarantee you, whatever the 1% or less than 1% side effect is, the rare one, you can mark that as that's Ann's. That's me.
Oh,
I'll
me
have that.
too. Every single time.
And I've also heard, again, it's not part of the biting, but if we're talking about EDS,
Mhm.
another thing that happens is we often develop an allergy to tape, and it progresses until we can't tolerate anything tape
Yep.
adhesive wise.
So that started for me about a year ago.
Mhm,
Um, I learned it because they had done an IV and they used the medical tape on me and I got hives all around it. And I was like, oh, that's weird. And they
mhm.
went to take the tape off and my skin came off with it. And ever since then, if I use anything, the only thing I've been able to use is KT tape, but that still gives me hives.
Oh, yeah.
I, in my records, you can only use silk tape on me, and even with that, I still get like raised bumps, but it's nowhere near as bad.
Yeah,
Everything else takes off layers of my skin.
yeah,
And duct tape is the worst. Oh my gosh, duct tape. I tried to use it on my tent about a year ago and I accidentally got some of it on my finger and it took off just a whole side. And I was just like, ah,
yeah.
there's nothing you can do.
Yep, I have to use silicone, brands.
Mm.
First time, I had a procedure and they taped my eyes shut, and so when I came out, um, I'm there sitting with my husband and the social worker comes and, uh, she with my husband there, says, "I'm sorry, are you safe at home?" Well, 1, you're not supposed to ask that question with the spouse there, but I was like,
Yeah.
"I'm sorry, excuse me, what?" And she's like, "Your eyes, you have black and blue eyes. Did he has he hit you while you're here?"
Why would she ask you that right in front of him?
"Well, I don't know. I really
Oh my
don't know.
goodness
We're talking about
gracious.
really crazy things." So
Yeah.
I said, "What do you mean?" And somebody gave me a mirror. And here's the thing. If I don't think I had glasses at the time, but I had perfectly rectangular starting up here, going through here, down to here, red, and then the black and the blue where
Yeah.
they taped my eyes shut. And when I looked at it, I was like, "You can clearly see this is from the tape." "Well, you didn't tell anybody you had a tape allergy." "Well, I haven't had one until
Yeah.
now. So FYI, allergies pop up whenever they feel like it."
They pop up and they leave. That's one thing to keep in mind. I was anaphylactically allergic to hot Cheetos my entire childhood. And after my first kid, I love them now. I can eat them, no problem. We never figured out what it was, but now I'm allergic to tape and then whatever else is here environmentally, and then some compounds that are in body washes and shampoos. That's never existed before for me.
I have an idea.
Hmm.
I have a child who loves clean teeth and went to a new dentist, and they did the floss, and
Mm-hmm.
she cried, and she had whiskers, and I asked what that was. They used Crest Glide floss,
Oh.
so I made a bracelet like you have on, a loose one made out of Crest Glide.
Uh-huh.
It is covered in Teflon. She was also my weird child who would eat anything out of the cupboard, but wouldn't eat anything I cooked for her.
Uh-huh.
Also needed to try on all of her clothes because of how they felt. Now, you would think that that would be autistic, possibly.
Uh-huh.
Well, within 15 minutes, I cut that thing off. It was so tight. And we have figured out that she is allergic to Teflon. It is
Wow.
on any clothing that's wrinkle resistant, permanent
Yeah.
pro. It's in some soaps because it makes it slick on your body, and you know how people sometimes, I don't know. So,
Yeah.
especially when we visit other places like, uh, maybe that have more economical
Uh-huh.
options,
Yeah.
the Teflon must make it more economical.
Yeah.
The
It's a cheap.
napkins at fancy restaurants, when
Mhm.
I forgot to get her a new one, and she was eating some macaroni and cheese, she's like, "Mom, Mom, did I get all off my face, Mom?" I was like, "Yeah. Hey, sweetie, let me have that napkin." And I balled it up. I let go of it and it went flat. I was like, it's the Teflon. She can't do
Chiffon.
that." So when we use Teflon cooking, as you do when you have little ones because
Yeah.
you want easy cleanup, she was getting sick. So we had to
Oh
go to
my
all
gosh.
stainless steel or cast iron or that type of thing. So maybe.
That is so interesting. My daughter had that to a white Halloween makeup last year.
Mm,
She was supposed to be a vampire, so she got like a white base face paint. She didn't
mm,
end up using it on Halloween, but the next day we were home and she was like, I'm gonna do my makeup all cool. I was like, girl, go for it. And she
mhm.
does her makeup and she's like, it kind of burns a little bit. I was like, okay, then let's wipe it off. Maybe you'll have an allergic reaction. Maybe it's fine. I thought we got it all out. She had some in her eyebrows. The next morning when she woke up, her eyebrow was swollen over her eyes and she couldn't see. And she's like, Mommy, I think something's wrong. And I was like, oh my God.
Yeah.
We were able to finally get it all out, give her Benadryl. It went down, but she's the only one that out of all three of them that has ever had anything allergic like that ever. It
That
was
that that
terrible.
child is also uniquely allergic to lavender.
Lavender.
Why? Why did it have
That's
to be
so
lavender?
common.
Yes, it is.
Mm-mm.
So yeah, that's a challenge for those things, those unique things that we find with EDS.
Yeah.
So uh yeah, I think there's that book that we talked about. We could do, you might have EDS if, or
Yes.
here's your sign. You you are a zebra. I'm sorry I got a Southern accent, but I was referring to Jeff Foxworthy, who has a Southern accent. I'm not
Yes.
suggesting anything else other than Jeff Foxworthy and uh, the other guy have Southern accents and they have those routines. So, um,
Yeah.
what was one of the most curious things that you found that was related to EDS? Like, never did I think this was gonna be this.
Honestly, for me, it was that I've had migraines since I was 4. And with my family, when those started, my grandma's had migraines since she was young. My mom has. So I figured that's just part of life. Everybody experiences is this. That's how you go through it. And then I started having really, really bad pains in my shins and in my knees as a child. And I finally last year went and got imaging done, a CT scan done of my shins and my knees. And it come to find out that I have a NOF compatible lesion on my shin. So an actual lesion on my bone that's only able to be accrued in adolescence. So I've had a lesion this entire time, and that's what's been causing the pain. I thought it was just I was getting shin splints from my shoes. I was getting like just had pain here and there. But like if you feel my shin, you can feel there's a divot. It's
Mhm.
very interesting. So for that one, that was a big aha moment for me. And if you look on the comorbidities site,
Mm.
NOF compatible lesions are on there.
Ah,
So it's been connected from day one, and the migraines also are. When I was 8, they diagnosed me with chronic migraine syndrome. Now, that doesn't exist. That's not an actual thing. It's something that the doctor made up to where we didn't have to look any further into it because they did CT scans, they did MRIs, they did all this stuff on my brain, couldn't find anything. It's EDS. But now knowing that I have EDS, they're able to medicate me for my migraines in a way that's actually effective. They have me on a seizure medication, although I do not have epilepsy and I do not experience seizures. It's been working for me. So I could have had this relief from my migraines, from these pains, if I would have had a diagnosis sooner and understood what was going on.
got it. And have you ever been evaluated for CCI, cranial cervical instability?
Not yet. So I am waiting. I have an appointment in early February with the musculoskeletal doctor specifically for that.
Okay.
I did get checked for Chiari malformation. I do not have one. So we got a positive going in there.
I
Now
do.
it's moving into everything else. I know. Don't envy you.
Um, and
Mm,
and so yeah, that would be the tale of two zebras in that it doesn't I am currently not able to get any care. Uh,
right.
so
And
uh
specifically, people aren't listening to you.
or yeah. They're not listening to me. Actually, they're not even accepting my appointments. I do have a primary. He has tried referring me, and I have been rejected before even being seen because they're able to look at my file online
Yep.
and it's too complicated. So that's um, a fight I think a lot of people with
Yeah.
EDS also have, and it's very draining and um, you're doing so much education of yourself and probably with less brain power than you should because
Yeah.
I mean, the way the geneticists described it to me is that walking a block is like walking a mile. Our bodies are constantly working to stay within, range to keep
Right.
it from subluxing. And so walking is so much more work for our bodies. And then I've been told that that will also say, "Hey, you seem to be running a lot and doing a lot. We must be in danger." So it gives us the fight flight response.
Yep.
Um, and then we're not able to rest and digest. So we have
Right.
digestion issues and uh yeah, that's a challenge. So
The domino effect. I went
yeah.
through 9 musculoskeletal doctors that as soon as they saw that I had EDS, they dropped my case. Wouldn't
Uh-huh.
even see me, nothing. So it's very, very common. It goes back to what you said earlier of, you would hope that these doctors are educated in this and understand, but honestly, there is a huge ignorance, systemic ignorance when it comes to Ehlers-Danlos syndrome. Although this disease has existed since 1914,
Mhm.
prior to the last couple decades, doctors were looking for Ripley's Believe It or Not symptoms. So
Yeah.
skin that you can grab and stretch all the way out here, contorting yourself into a ball. We can't all do that. And it's a sliding scale, just like any other disease where you can have a small amount of symptoms or it can be extreme, or we also fluctuate throughout that.
Mhm.
So it's
Yeah.
finding a doctor that understands what EDS is, and unfortunately, sometimes we are their first EDS patient.
Oh
We
yeah.
are the guinea pig. We are who they learn by, and it sucks, but if you get a doctor who's willing to do that work and willing to learn,
Mhm.
put in that time. Put
Yeah.
in that time.
Actually, I this is gonna sound rude, possibly.
No.
Hearing that you had to go through 9 doctors, I was like, "D is Amberlyn just the luckiest?"
I know. I
I was
know. No,
like,
it
"How
is
does she
so
get all these
true.
doctors who are, like, working with her?" And I know better, but 9
No.
is a lot,
Honestly,
and to
it's
keep
true.
persevering through that, that's hard, you
It's
know?
nothing compared to all of the stories that I've heard, and your story being one of them. I think the biggest thing that I've found that's helped so far is before I choose a doctor, I go through the EDS Society's directory of doctors.
Nice.
So I find doctors that already speak EDS, or I'm also on a couple of Facebook groups for
Mhm,
Tucson locally for EDS, where I
mhm,
can put the question out there and saying, hey, these are the symptoms I'm experiencing. This is the kind of specialist I'm looking for. This is the insurance I have. Does anybody have any recommendations?
yeah,
Rather than taking that shot in the dark and ending up with these shitty doctors that I know is going to be bad experience, waste my time, waste their time, waste my insurance money, I'd rather just go straight to the source
yes.
because they do exist out there. It's just trying to find a damn needle in a haystack.
Yeah. I think also the one of the most beneficial things that you've shared with me is how you approach the doctor in
Yeah.
bringing the bite and saying, "Please convince me I don't have this."
Right.
Because having so much experience, I've worked with my therapist actually in that I have been told I'm intimidating
Eh,
because well spoken or well educated, and I'm just like,
that's
okay,
on them.
that I okay, but it is on them, but I still need their help. And
Yeah.
they're turned off by me because I'm dictating and I'm really
Yeah.
going in looking for a team member. I don't want to be dictated to, but I get
Right.
don't want to be dictated to. We shouldn't be. I'm hoping we're teammates and
Right.
I understand it's a lot of information, so I'm going to bring what I know. Can you look at it? Give me your thoughts on this, and then we'll see
Right.
if maybe something might like click with what's going on with me type of thing.
Yeah.
So that is a whole lot of stuff for people who are uh possibly putting a toe in the EDS world and trying to
Yeah.
figure out what's wrong. It's a whole lot of, oh my gosh, that's me too for the zebras that are,
Mhm.
and I hope that people can hear the podcast and recognize they're not alone, that
Mhm.
it's a challenge, but there is help out there. We might have
Absolutely.
to find it and we might have to be creative. That's where that neurospiciness I understand comes in.
You don't have to struggle through it alone though, because we are all struggling through it together. Whether you found your unicorn doctor yet or not, they are out there. They are. We just gotta find them, and we
Agreed.
will.
So, thank you for going through the scale with us.
Of
I'm very
course.
proud of myself for not partaking, even though I
I'm
could
very proud of you. Yes, we do
have.
not need to do that. Let me do it for you.
And so, I love the fact that my picture I think is crooked now. I don't know. Oof.
I didn't think it was.
I don't
Just
know,
don't
but
trip.
okay, that's an OCD thing. I am gonna not. We have to fix that for our next uh recording.
We're working on getting you a banner to go behind you. It's okay.
You can see where I had a pick line.
Yeah, you can. Oh my gosh.
So the skin writing, we didn't talk about that. Um,
No, we haven't yet.
there's so much to talk about, so much to cover. So we will be doing this weekly. Come back and join us. We're
Mhm.
working on getting this on a YouTube channel, and we're done.
Yeah.
Why am I? Why am I done? I know. What? This has happened so not. This is not cool, people. You
Her
go,
computer hates
Amberlyn.
her.
All right, Amberlyn, can you hold on. Maybe I got it. Nope. 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 All right. This is the way it goes with us. I have no idea. Amberlyn, can you please stop the recording?
I will try and figure out how to do that. I've never done that before.
It's it's down below.
I think the only way that I can do that is if I leave.
Okay. What? Oh, there we are. I got us.
You got
All righty then.
Oh.
I'm gonna figure this stuff out. I promise. This is so much fun.
Yes.
All right. I'm stopping the recording and
Bye.
bye bye.